Okay, this is fascinating, and I think you've already answered a lot of my next question, which is to try and understand like what can we do, like what can we actually do with this information. So what I heard you say so far is make sure to eat 1 to 2 hours after waking up, eat all your food in an 8 to 10 hour window, make sure to get adequate sleep. What other things can people do with this information that you've uncovered?
Yeah, so I guess we can encapsulate or we can come up with a few, I don't want to use the word rules, but let's use it. So let's come up with 6 rules
Let's do it.
or guidelines. Okay, so number one is 8 hour in bed. Um, Best thing is to go to bed at a consistent time and to be in bed for 8 hours so that you can get at least 7 hours of restorative sleep. It doesn't mean that you have to sleep for 8 hours. You just try to get 7 hours of sleep. Because during our sleep, our circadian clock turns on hormones and chemicals to repair and rejuvenate our bodies. So, for example, our gut lining gets damaged every day, and that's during our deep sleep, our brain produces growth hormone. And also during deep sleep, that's the one, if our stomach is empty, then our gut lining can repair. And there are many other benefits. So 8 hours in bed is rule number one. Number two, wait an hour before your breakfast, because after waking up, this is the time when organs are slowly waking up, the night hormones are falling, and then the day hormones are rising, and your body is not fully ready to properly digest food. So avoiding food for at least an hour or two after waking up can help to better maintain your blood glucose level. So that's number two, is to wait for an hour or two after waking up. Number three is now very popular. That's called intermittent fasting, or we call it time-restricted eating. And this is the core of the circadian optimization plan, because, as I mentioned, eating time seems to be the most robust signal to entrain our clock. So eat your breakfast or the first bite of food at a consistent time, because breakfast synchronizes circadian rhythms in all organs. And starting from breakfast, eat or drink all your meals for the day in the next 8, 9, 10, or maximum 12 hours. And this pattern of eating and fasting is the most powerful habit to boost your circadian rhythm in every organ. And it has numerous benefits, including better handle on your weight, blood sugar, blood pressure, liver function, kidney function, and many more. And then number four is 30 minutes of daylight. As I mentioned, each day, if we just get out for 30 minutes, that's the best antidepressant. It elevates our mood. And also there is new data showing that if you get better daylight in the daytime, somehow, we don't know the mechanism, it improves our nighttime melatonin production, so we can go to sleep much better. And also we should not forget that daylight is the good source of vitamin D, which keeps our many organs healthy. So then number five is afternoon exercise. We haven't talked about this, but there's now new research from many circadian rhythm and exercise labs saying that if you're pressed for time, try 30 minutes of brisk walking in the late afternoon or evening, because that's when our muscles are most efficient and we have lower risk for injury. And for those with diabetes, exercise in the afternoon or evening is more potent, is more powerful in controlling blood glucose than the same exact exercise in the morning. So this is also another aspect of circadian rhythm, and hopefully people who are exercising with diabetes, then if they move their exercise regimen to the late afternoon, evening, then they can better benefit. So that's number five. And then number six, now end of the day, avoid food and dim down your lights for 2 to 3 hours before bedtime, because no food before bedtime improves digestion, reduces heartburn, and also better help you with blood glucose control. And dim light boosts the production of nightly hormone melatonin and prepares your body for a good night's sleep. So those are the 6 rules.
Okay,
Hopefully,
this is great. Now I'm super curious to learn a few things from you. because of that list. Like, there's these lights that people are selling, like a red light, or these like certain yellow lights. I'm not going to name any brands or anything, but like, are
Yeah.
these things actually beneficial? Is there research behind them?
Well, unfortunately, there is not much research using specific products.
Okay.
But what is important is we know that reducing blue light, dimming down light at night is powerful enough to improve our melatonin production. So, for example, research has been done on, say, people using tablets, example, iPads or Galaxy Tab, whatever you can say. If you have those tablets at full brightness and you're working on those tablets, at that light level is enough to reduce your melatonin level and keep you awake for a long time. And if you reduce the brightness on your tablet or change the spectral color to orange color before bedtime, that actually helps some people to go to sleep. So now if we extrapolate that, then it's reasonable to say that, you don't have to go and buy new light. The first thing you can do is just pay attention and dim down your light. Reduce light exposure in your room. And if you want to work on something, then you can use work light. So like a table lamp, the old style table lamp. So you don't have to illuminate your face. You illuminate what you're reading. And some people find it even easy to buy a pair of good blue filtering glasses. I don't want to name any specific brands because there are now many. The bottom line is if you can see the glasses are yellow or funky red in color, then that's a good sign that it reduces enough blue light. And the reason is, for example, in the evening, you may go out to the drugstore or a grocery store, and most of the drugstores and grocery stores now have at least 1,000 lux of light, which is similar to you sitting next to a window on a on a bright day. That's the amount of light. That's very effective in reducing your melatonin level. So if you're curious why when you go to a drugstore or grocery store you don't feel sleepy, you feel very alert and you continue shopping, that's because of the light. But if you have blue filtering glasses, of course, not many people I see, they wear them to the stores. But at least you can avoid going to stores with bright light in the evening. So there are some practical tips that everybody can incorporate into their life.
Okay, that's super helpful. Now, another question I have based on your 6 rules you gave us. How detrimental is it for somebody to like get up in the middle of the night to pee? Because sometimes people they start following them.
That's normal.
It's not that bad.
It's not that bad because that's also something that you have to take care of, because if you don't pee, then you are not going to sleep well for the next 3 to 4 hours.
It's an interesting conversation. I can't say I've read too much about it, so I'm excited to learn from you. But like sometimes when people start following a plant-based diet, it's much more water-rich, and they're much more hydrated. And sometimes they have to go to the bathroom while they're overnight, and they get concerned. Oh, it's disturbing my sleep, and that's not healthy. So I'm just curious what you've learned about that.
No, we haven't seen any detrimental effect that way because the most important thing is to get that 7 hours of. I don't say that they have to be continuous 7 hours with uninterrupted sleep. Of course, we understand that. We all know that there are sleep cycles. They repeat in every 90 minutes or so. So that means in every 90 minutes or so, your sleep is little light, and more likely that's when you are waking up to go pee. But the most important thing is your total sleep, 7 hours, 6.5 to 7 hours or not. That's much more important.
Got it.
Okay, so then let's review those 6 steps one more time, because I just want to make sure that people walk away from this podcast understanding exactly what tools they have at their disposal to try and minimize the disruption that happens to their circadian rhythm in the modern world. Number 1, spend approximately 8 hours in bed and try to be as consistent as possible. Number 2, wait at least 1 hour after waking up in order to start eating food. Number 3, perform time-restricted eating in the sense of try to limit your food intake to approximately 8 hours from the time you start to the time you finish. And it can go as into 9 hours or 10 hours, but a maximum of 12 hours of eating within the day. Number 4, try and get 30 minutes of daylight. Let me be clear here. Is this 30 minutes of like sun exposure to your skin, or is this 30 minutes of light for your eyes?
This is 30 minutes of light for your eyes, and I must clarify here. Even on a cloudy day, if you go out, there is nearly 5,000 lux of light. And what we need is at least 1,000 lux light for 30 minutes. So that means even if it's cloudy, it's better to go out. And on a sunny day, you can just go and sit under an umbrella, or you don't have to be under sun exposure.
Got it. Okay, cool. So you're talking basically about getting light going into your eyes, because that is going to help regulate your circadian clock inside of your brain and beyond. Okay, great. Number 5, perform afternoon exercise. You said that afternoon exercise is better for people with diabetes. And the reason for that, one more time, is why?
So there are a few things. One is we know that the pancreas function, as we discussed, goes down with days. So in the late afternoon, our pancreas is not that efficient. But we must not forget that glucose also gets absorbed into our cells and body, different parts of the body, independent of insulin. And muscle is the biggest part of our body. It constitutes more than 60-70% of our body. And when our muscles are active, they can soak up glucose with very little or no help from insulin. So in a way, if you perform that exercise or physical activity late in the afternoon, you are compensating for low insulin production by the pancreas. And then second and third reason are, in the late afternoon, your body is also warm enough, so your muscle is most efficient for exercise. And for some reason we don't understand yet, you have low risk for injury. We must remember that many people who have diabetes, high blood glucose level, they may have little extra weight, and they may not be able to do much more exercise because they get tired, or their joints and ligaments are not that strong. So for them, injury from exercise is a big risk. And since the injury from exercise is low in the late afternoon, that's another reason why they should exercise in the afternoon.
This is fascinating because I was unaware. I mean, one of the tenets of the Mastering Diabetes method is to get and find a way to move your body for a minimum of 30 minutes per day. And we refer to movement as being a powerful insulin sensitizer, in addition to a low-fat, plant-based whole food diet, in addition to time-restricted eating. So the combination of the three of those is sort of the metabolic trifecta, which gives you 3 ways to insulin sensitize yourself, which decreases your risk for insulin resistance, which then decreases your risk for prediabetes, type 2 diabetes, and complications of type 1 diabetes. But I was unaware personally that the time of day that you exercise matters. And
this is very new. This is only in the last 3 to 4 years. The results came out, and it has been now repeated. And there's a famous study that came out from Karolinska Institute where type 2 diabetic patients who were wearing continuous glucose monitor, they were given the same exercise in the morning, and then there was a crossover, and the same patient, same individuals did the same exercise in the afternoon, or vice versa. There was another group. And what they found is within the same patients, the afternoon exercise reduced 24 hours blood glucose, whereas the morning exercise either maintained, in some cases even increased the 24 hours blood glucose. That was really surprising. And initially people didn't believe it, and slowly we are seeing similar results coming out from independent labs.
This is fascinating, actually. This is fascinating because I love learning about new biology, especially when it's biology that actually has a very strong connection to the development of many chronic diseases. Like you mentioned before, diabetes for sure with blood glucose control, but also cancer, because you mentioned that shift workers are at an increased risk for both diabetes and cancer. So does exercising in the afternoon only lower your risk for diabetes and sort of blood glucose irregularities, or does exercising in the afternoon also help limit your risk for other chronic diseases like cardiovascular disease, cancer, autoimmune diseases, and beyond?
That's when being a scientist, since I haven't seen the real clinical trial, it's a little bit stretched. But I can say that, for example, now in cancer treatment, it's very well accepted that maintaining your blood glucose is very important for cancer treatment, because many of the cancer drugs actually work better, and your tumors actually grow less aggressively if you maintain your blood glucose level better. So in that way, we can say that time-restricted feeding or any intervention that helps you maintain your blood glucose level will ultimately reduce your cancer risk. Or if you're going through chemo or cancer treatment, you should also talk to your doctor to see how to maintain your blood glucose level within healthy range, so that many of the chemo or the immuno and many other treatments are more effective in shrinking your tumor or reducing your future cancer risk. So along that line, one thing that we know is for women who are breast cancer survivors, if they eat within 11 hours and fast for 13 hours, then they have low risk for relapse of breast cancer. But when it comes to exercise, morning versus evening exercise, and how it relates to, say, relapse of cancer, so that will be interesting to find out. And hopefully there are some listeners here who are working in biomedical research. They can go back and look at historical data or do new research.
I'm excited to dig into some of this new research you're talking about here. But correct me if I'm wrong. I'm assuming the researchers and logic would lead us to say that it's still okay to exercise in the morning if, like, that's the only time you can fit it in. Like, it's still better to move your body whenever you can than to be like, oh, wow, like I have to get off work at like 3:30 now in order to follow the science.
No, absolutely. I mean, I must say that exercise anytime is way much better than no exercise at all. And if you have a choice and if you want to further improve the benefit of exercise and you have the option, then you can optimize it by doing the exercise in the afternoon.
Totally. Love it. Okay. Cyrus, you going to say number 6?
Good clarification. Number 6, finally, the last point that you brought up here was to try to limit your exposure to blue light, or I should say like incandescent light that comes from many, commonly found light bulbs, and to not eat food for that same 2 to 3 hour window before bed. And if you were to perform all 6 of these, or try to integrate as many of these 6 different tools that you have given us, that is a way of limiting the circadian disruption that can then increase your risk for many chronic diseases. So is it safe to say that people living with pre-existing prediabetes, type 2 diabetes, type 1 diabetes, if they start to take this information to heart and they say, okay, you know what? I listened to this podcast with these guys and this guy named Dr. Panda, and he told me that if I do these things, then I'm going to see better blood glucose values. So if you're already living with a form of blood glucose dysregulation and you start to integrate these tools into your life, is it safe to say that you are likely to see improved blood glucose within days, weeks, or months?
Yeah, so there are now very specific clinical trials addressing this specific question, particularly using the core. One of the core is the time-restricted eating or intermittent fasting that's now popular in popular media. We have done clinical trials that are published showing that 10 hours time-restricted eating. So that means if you start eating, say at 8 o'clock, you continue eating, maybe your window for eating closes at 6 p.m., or if you start eating at 10 a.m., then it stops at 8 p.m. When people do this, then their blood glucose level definitely improves. Those with pre-diabetes, they may be able to reverse their diabetes. And as you mentioned, it's also good to combine this with complex carb, not the processed food, so that you improve the effect. And now there are also clinical studies from other labs, not our labs alone, showing that time-restricted eating of 8 hours to 10 hours, combined with your doctor's monitoring, because, depending on what kind of medication you are on, fasting for 14 hours or 16 hours can cause a little bit of hypoglycemia. So it's very important that if you have a continuous glucose monitor, or if you consult with your doctor, there are certain medications like sulfonylurea that can reduce your blood glucose to dangerous levels. So you can consult your doctor and then try this. And we have seen many clinical trials showing that people can better control their blood glucose. In some cases, they can reduce the dosing of their diabetes medication. And in some studies with type 1 diabetics, people are also finding they can better manage their blood glucose with less insulin.